Recently started using it, but I mean, one problem is that we don't have machines in the dialysis unit. If at all we do have, they are just restricted to having a vascular probe. So, I mean, like after I started using Cosmos, I started doing some VExUS on dialysis patients. I mean, it's almost impossible to get renal waveforms, but at least hepatic and portal waveforms. I started titrating ultrafiltration or dry weight based on that. And I cannot say what are the long-term outcomes and stuff because I go to dialysis unit maybe once or twice a month. So I've been using only for the past few months and I found it helpful and it is doable. I'm just learning my dynamics, like how to sit there and get the waveforms without breaking my back. As you know, the dialysis chairs are not the most comfortable things to do VExUS. Yeah, but they can be used. And I even published a case report that these waveforms change in dialysis patients. That's for sure.
I think that's an interesting question, though. And Abhilash, I mean, you have such a good patient population to study this. And I wondered, even as you're presenting this case, you know, are normal waveforms the target in everyone? I don't think they are, probably, you know, in some people who have other concomitant cardiac pathology. So it's interesting then, like, what is your, like for that case you presented, was your endpoint, like, were you trying to diurese to normal VExUS waveforms? Were you diuresing to creatinine, to physical exam? I would imagine a combination of all three. But I suppose they're a useful point to follow, but not probably the only thing that you're following in those cases. Is that fair?
Exactly. I mean, it's always a multi-point thing, whether it's dialysis patient or not. So, I mean, in both those cases, IVC was still big, right? Like it's not gonna give much information. And I mean, you don't want to diurese so much that you reduce the preload and ultimately you reduce the forward flow. And same applies to dialysis patients. Yeah, that has to be studied. For now, the data in the dialysis patients is all about lung ultrasound. But I think adding VExUS is definitely adding a very important data point that you can follow, because lung only tells you about the left side of the heart, and which you may or may not be able to address during your 4 hours of dialysis and ultrafiltration.
I guess